Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 19,445 cases of COVID-19 in 99 counties. There have been 682 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 585 hospitalizations across the state from COVID-19 illness. The number of positive COVID-19 tests in Dare County has remained at 22 for the last 5 days. Of those 22 Dare County cases, 19 have recovered or are asymptomatically cleared, 1 died, and 2 are active. Of the 2 active, 1 is hospitalized and 1 is recovering in home isolation. For the most up-to-date information on COVID-19 cases in Dare County and the state of North Carolina, visit darenc.com/COVID19. I will now provide trend updates on the 4 key metrics we are tracking as part of our disease investigation and surveillance. This trend data provides information on the intensity and spread of COVID-19 in our community. Because data has limitations, no one metric should be viewed in isolation. The 4 key metrics we are tracking are weekly number of tests, laboratory confirmed cases, positive test as a percent of total test, and COVID-like illness surveillance. We will continue to update the data for each of these key metrics on a weekly basis and share this information in Tuesday videos. The weekly number of tests. This graph shows the number of tests being reported in weekly increments. 588 COVID-19 tests have been reported to Dare County through May 17, 2020. The number of tests continues to increase over time. 90 tests were reported this past week. As indicated last week, the graph also shows a significant increase in the number of tests reported during the week of April 6th through the 12th, which is when mass testing of peak residents and staff occurred. Providers in Dare County continue to follow the testing guidance provided by the North Carolina Department of Health and Human Services. This guidance recently expanded testing criteria. The criteria still includes testing individuals with symptoms, but encourages providers to test anyone whom they believe may have the COVID-19 virus. We have been working over the past few weeks with a private lab company to finalize arrangements to host drive-through COVID-19 collection sites to test for COVID-19 in Dare County. We expect to provide details on this initiative within the next few days. Information on the drive-through testing will be available through media releases, social media, and on our website. The second metric is laboratory confirmed cases. This graph shows the laboratory confirmed cases by date. Dare County saw an increase of 1 positive test this past week. This information is updated daily on our website. On the Dare County COVID-19 webpage, there is a section for quick reference which provides the most up-to-date information on COVID-19 cases in Dare County and also the state of North Carolina. You can find this information at darenc.com/COVID19. The third metric is positive test as a percent of total test. The number of COVID-19 tests being reported has been increasing over time in Dare County. As testing increases, there may be more laboratory confirmed cases. Looking at what percent of total tests are positive helps us understand whether laboratory confirmed cases are increasing in comparison to the number of tests conducted. The percent of positive tests to total tests in Dare County has remained stable for the past several weeks, around 4.2%. This week, our percentage decreased slightly to 3.7%. The Dare County percent of positive test results to total test is lower than the North Carolina average, which is around 7%. And the fourth metric is COVID-like illness surveillance. In North Carolina, we receive emergency department data in near real time using the North Carolina Disease Event Tracking and Epidemiologic Collection Tool, or NC Detect. This is an effective way to track respiratory illness, including COVID-19. As you can see from this graph, the percent of emergency department visits with COVID-19 related symptoms remained low this week, similar to the past few weeks, in that only a small percent of patients presented to the emergency department with COVID-like symptoms. The limitation with this data is that it only represents people seeking care in the emergency department. We remain in close communication with the area urgent care centers and work with them daily on syndromic surveillance. I'm excited to share with you today a great new project the state has announced called Count on Me NC. The Count on Me NC program is focused on providing the necessary knowledge and information needed to manage COVID-19 within businesses as restrictions are relaxed. These free courses provide a consistent approach based on state and national guidelines. The voluntary program is designed to incorporate the best available science in social and physical distancing, employee health, and cleaning, sanitizing, and disinfection, and is presented in an easy format in both English and Spanish. Each of these short training sessions are under 30 minutes and delivered online in an engaging and interactive format. Participating businesses will be recognized on the website. For more information, visit countonmenc.org. In closing today, I want to remind everyone to practice the 3 W's to continue to slow the spread of COVID-19. Wear, wait, and wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.